Now, the South African Human Rights Commission is calling for the termination of rotational learning in primary schools. It says it has been informed by about 86% of schools in the Western Cape have applied for rotational timetables for the 2022 academic year. For more on this, I'm joined now by Adv Andre Gaum, a commissioner at the South African Human Rights Commission. Commissioner, good evening and thank you very much for your time. This question of 100% school attendance, of course, has been debated for a while now, including in April, where that whole workshop was held with the department, where what came out of that was that you will be getting direction, certainly, well, the education sector, from the health professionals. What are the health professionals saying now?
Yes, we base our view on the advice of the Ministerial Advisory Committee on COVID-19, which is a committee that is comprised of experts from various fields, including the medical profession in particular. And their advice is that the rotational timetables, especially in primary schools, should now be terminated. And we are aware of the fact that there are still many schools, many schools in our country rotating at the moment, and that many have also applied to rotate in 2022. You've referred to the case of the Western Cape, where there were applications. That's not, that doesn't say that they've been granted, but there have been applications of 86% of the schools. So the Commission holds the view that rotational learning has a long-lasting negative impact on learning outcomes for children. And as the Ministerial Advisory Committee's advice states, that the harms of learners attending school on a rotational basis, specifically the severe cognitive, nutritional, as well as psychosocial costs, exceeds the benefits of reduced COVID-19 infections from smaller class sizes. It is quite clear from the evidence that we have reduced transmission and virus acquisition rates among teachers and learners in these primary schools, as the majority of educators have been vaccinated and due to the low acquisition risk profile of primary school learners. So therefore, the Commission agrees with the Ministerial Advisory Committee that all primary schools should open at full capacity. Yeah. We have written to the Ministers of Basic Education, Health and Cooperative Governance and Traditional Affairs for an urgent meeting to look into the termination of rotation in primary schools. This would essentially mean that the COGTA Minister, Minister Nkosazana Dlamini Zuma, needs to amend the directive by deleting the 1 meter social distancing requirement in respect of primary schools. But we will also discuss the return to normal school timetables for high schools, as the same factors are present there. First of all, the acquisition rate is much lower in comparison to the rest of the population with that age cohort. Secondly, the teachers in those schools have been vaccinated, largely so, if not all of them. And thirdly, there's the additional factor that the Department of Health has now commenced with COVID-19 vaccine rollouts among 12-year-olds and older age groups as well.
Up until this point, of course, the debate is always around safety, and you've already mentioned the question of the 1 meter social distancing, which really would have been a major factor in certain schools who don't have enough classrooms to be able to put that in place. And the associations in the education sector have been saying, well, they would not want some schools are open, some schools are not. Type of arrangement. If they are to open, then all of them must open. So do you believe doing away with those protocols will certainly ensure that all schools are able to open safely?
We believe so, yes. If we look at the Ministerial Advisory Committee's advice in this regard, it also clearly states the factors in favor of such reopening. And I want to repeat again, they say that the harms of learners attending school on a rotational basis, specifically the severe cognitive, nutritional, because the feeding scheme is then not in place, and psychological costs exceed the benefits of reduced COVID-19 infections from smaller class sizes. And I've referred to the lower risk in terms of virus acquisition. I've referred also to the teachers that are vaccinated. So we believe that in weighing up rights and all the factors involved here, including the medical factors, it would indeed be safe. But we also need to take into account the immense cost that has been in place for these learners, especially from poor communities, for many, many months and even years. There were times when schools were closed. Now, with having to rotate, they basically only have half the teaching and learning time in schools compared to, for example, many of the ex-Model C school compatriots who are going to school on a full-time basis without any rotation taking place at all. Yeah. So taking into account all factors, we believe now is the time, and I'm quite pleased also that in an interview I had this morning, followed by Elijah, the spokesperson of DBE, he also stated that the DBE, Department of Basic Education, strongly supports the view of the Commission in this regard.
Yeah. What's the suggestion then around the anxiety that will, of course, still be there? Because science may say it's okay, but anxiety, of course, is differently because parents, for example, have read all sorts of things around the virus. They've heard all sorts of things. Some of the learners themselves, even the teachers and education staff have read all sorts of things. How do we address that question?
Yeah, that's absolutely all about education, and there the provincial departments of education and the district officers will have to play their part in conveying the relevant and correct information to all stakeholders involved in the education system, parents, teachers, staff, everyone involved, so that their fears can be allayed.
From your meeting on Monday, you get a sense that the department would want to agree on the move that you're wanting to take. What are the next steps that will be now followed?
Yes, well, I mean, as Elijah also pointed out, the health has a great stake in this, and that's why we have also requested the meeting with the Minister of Health. And in the final analysis, it is the Minister of COGTA that issues the directives that overrides other directions from other ministers. So that's why we have specifically requested this meeting with all three ministers to have an open and frank discussion about this and to indicate to them exactly what our view is, which is, as I say again, in line with the Ministerial Advisory Committee on COVID-19's views. So we hope to convince the ministers that this is the correct way to go forward.
Andre, I appreciate your time. Thank you very much for joining us. Advocate Andre Gaum there from the South African Human Rights Commission. Of course, they are now calling for 100% school attendance by all.